Hello and welcome to this special program, Africa and the Coronavirus Challenge. I am the France 24 correspondent in Cameroon, Indira Ayuk. In the course of this program, we will be bringing to you a glimpse of how Africa is combating COVID-19. You will have reports and interviews from South Africa, from Kenya, from Madagascar, and from Tunisia. But first, let's begin in Yaoundé, the capital of Cameroon. We are at a busy bus station. Here, people board buses every day to the outskirts of the city. We are in the heart of Yaoundé. This 18-seater bus transports mostly students from the center of the town to the outskirts of Yaoundé. Most of them have no choice but to get on board these buses as it is very affordable.
C'est le moyen le plus moins cher. À 250, je me retrouve à soi, alors que si je prends le taxi, je vais prendre 2 ou 3 taxis à peut-être 1000 francs.
It's very difficult to respect the 1 meter distancing. But we'll just put on our face masks and just hoping that God should protect us, because it's very difficult. Even when they were not carrying many passengers, the distance was not still up to 1 meter.
Like drivers plying this road, Alain complains of the difficulties he faces in his business since the outbreak of the coronavirus.
Aujourd'hui, ça avance, c'est difficile, parce que les gens ne sortent presque pas. Le matin, on va voir quelques gens qui vont au travail, parce que notre ligne, c'est une ligne étudiantine. Déjà, le campus est fermé.
And this is what it feels like to travel in Cameroon's capital, Yaoundé. Now we're taking you to South Africa to discover with us the situation of COVID-19 in that part of Africa.
My name's ISMAIL and I'm one of France 24's correspondents in South Africa. This is the country worst hit by COVID-19 on the entire African continent. And Cape Town, where I live, is the epicenter of the pandemic. Why? Well, some say this is because Cape Town is the most economically developed city in Africa. For example, there are more shopping malls here than open-air markets, and supermarkets are among the city's worst hotspots. Lending weight to this theory, a report produced by Caroline Dumais, Stefan Carstens and Sam Bradpiece.
Another supermarket, another protest. These workers, like others across Cape Town, are furious with their bosses.
There's a people's test positive, 4 of them, but they only inform us about 1.
We want them to screen us or test us or anything that they can do.
We have kids at home. I have a 5-month-old baby, my granddaughter, and the mother is very scared.
The managers finally closed the doors without explanation. The death toll among supermarket workers has many worried.
We've heard reports of staff members from Checkers and other stores that have also, passed away.
Supermarkets across the Western Cape are closing one after another. The authorities are taking note. In an online press conference, the provincial governor said supermarkets have become coronavirus hotspots.
In the early days of those detections, I think there was a lot of learning going on. But it sounds to me through those meeting procedures that from small to big, they really have reached a new set of protocols.
There are already rules in place, but enforcing them has been difficult. Employees at this shop tested positive. The establishment was temporarily closed and disinfected. Today, the surfaces are cleaned every hour and the managers are required to report to health authorities where the ingredients of cooked dishes come from. The process is a headache for the owner and his 100-odd employees.
So we've got a health and safety officer dedicated solely with COVID, and then we have another individual dedicated solely with our normal cleaning processes around here. And then we have another lady whose sole job is to keep the lists of all the people that we've quarantined and the phone calls to them and the notes that they've made. So there's actually 3 people now involved in the health and safety of this area.
South Africans still try to maintain social distancing when entering the supermarket, risking life and death every time they pass through the door.
And now we go to Nairobi.
I am Mugelwa Shatrayo and I'm France 24's correspondent here in Kenya. We're looking at how the coronavirus pandemic is affecting neighboring Somalia. The first COVID case was identified in March, and since then, the numbers have been rising steadily. Now, they have over 1,500 cases. With me is Tino Matani. He's the Deputy Director of the International Crisis Group Africa Program. Now, Dino, I would like us to talk about the upcoming elections in Somalia. But first, let's talk about the public healthcare system. Can it cope with this growing outbreak?
Somalia is one of the most fragile countries on the continent with, a corresponding weakness in its health services. It's a country that's been racked by war, that's still partly under the control of Al-Shabaab jihadist militants. There are 2.6 million people or so displaced from conflict still. So in terms of the state of the country's infrastructure, the access of civilians to healthcare services when they're displaced or when they're under the control of violent armed groups, it's very difficult for the population.
How have the various leaders of the federal states and opposition responded to the possible delay of the elections due to the pandemic?
Suspicions are already high between the federal government in Mogadishu and the federal member states who have, on paper and in reality, de facto control of their own territories. That cooperation over the last 18 months has really tanked. The first thing that all parties need to do is come together to agree on how to handle the pandemic together. And then through that, or over and above that, start addressing the broader political issues about whether the election is now going to be delayed, whether there is a unity government that then agrees amongst itself how to then roll out the elections.
So how has the armed group Al-Shabaab responded to COVID-19?
Al-Shabaab have issued sort of muted guidance to the population under its control. At the same time, though, that the armed group is asking for people to protect themselves, they also have been encouraging them to turn up to mosques to pray. You know, I think the response by Al-Shabaab has been sort of contradictory, warning the population to take care of themselves as they don't want to be blamed for it, but at the same time ensuring that those people who are under its control are, still respecting the Sharia under which they govern.
Thank you very much, Dino. And now we head over to Tunisia in North Africa.
FADIL ALIRIZA reporting from Tunisia. Even though there weren't many cases of COVID-19 here, authorities imposed strict lockdown measures early on in an effort to head off a public health crisis. As those restrictions are slowly being lifted, Tunisians are heading back to work, trying to resume normal lives. We met some Tunisians who are saying that they hope the economy can recover quickly. In the city of Benzert, returning to normal isn't easy. Adel has been managing his small business for 20 years. During the coronavirus crisis, he had to close down for the first time in his life. He shut his business for more than a month and a half. Here, a total lockdown imposed early on changed some routines. On the beach, some locals are tentatively going back to swimming.
أول مرة خرجنا عنا بناية صغيرة جوست هكا نشموا شوية هواء باش نرجعوا.
حتى السياحة الداخلية نجموا يجيو يتفرهدوا الناس تفتكري الديار وناس تبدل الترتيح من المرض هذا العدوى اللي جات وربي يعافينا منها.
Tunisia had been preparing for the worst, especially given a lack of resources in the healthcare system. In the city of Sousse, thanks to donations, a COVID unit with a special mandate was created in less than 15 days in this hospital. So far, it hasn't had to operate at full capacity.
Ici, on n'a que 2 patients aujourd'hui et on n'a pas de malades graves, heureusement pour nous. Je pense que la crise de Covid nous a permis de dévoiler certaines défaillances et je pense qu'il est temps aujourd'hui d'une véritable révolution dans notre système de santé pour valoriser l'hôpital public.
Another big challenge is restarting the economy. In Tunis, in this textile factory that serves the export market, workers were shifted to making masks bound for Europe so the factory wouldn't go under.
Ça emploie une bonne partie du personnel, c'est déjà ça. L'essentiel, c'est qu'on saisisse ce créneau qui est important, qui est quasiment une aubaine pour nous, en attendant que réapparaissent à nouveau dans les radars les commandes de prêt-à-porter.
Out of the 80,000 masks produced in this factory each week, a portion will be given for free to Tunisian students trying to pass their high school or university exams, exams still scheduled despite the crisis. The lifting of the lockdown comes as summer begins, and many hope the tourism season can be salvaged. Many jobs have already been lost, but the Prime Minister has issued a decree freezing public sector recruitment as the state tries to cut some spending. At the same time, the government has identified 4 million Tunisians out of a country of just 12 million who it says are in need after this crisis. We turn now to my colleague in Madagascar.
I am GAELLE BORGIA, France 24's correspondent in Madagascar. Here, the crisis has above all been an economic one. There have only been a few hundred confirmed cases of COVID-19, but hundreds of thousands of people have been unemployed because of the lockdown. Just here in the capital alone, there are 160,000 families in serious financial trouble, according to official figures. That is 49% of the population of Antananarivo. We are in one of the biggest food markets of the capital. It is only open in the morning because the lockdown starts every day in the afternoon from 1 p.m. Here we can see the direct effects of the crisis. Street sellers are having a hard time selling their goods in half a day. Their incomes have fallen.
Ilay kry zany tena misy fiovana betsaka eo amin'ny fiainana andavanandro mponina miaina eto aminay satria taloha zao izahay raha oharina amin'ny entana amidinay malany omby roa zahay ao anatin'ny ray andro. So nefa izay lasa atsasaka omby ray zany amidinay. Izay sahirana ny vahoaka. Tsy ampy ny vola miditra eo aminazy. Sahirana satria samy olona mandovatra nefa betsaka ny olona tsy miasa. Ho an'ny mpitondra ambony le izy mety aminy le izy. Fa aminay vahoaka le izy tsy mety satria izay sahirana.
Sara fotsiny hoe malafo fotsiny zay lafo tapakany dia hohanina dia raha pitsiko ohatr'izay dia tsisy tsony masaka reny fanampiana nefa tsy misy hoe anampy anay izy le teo hoe batra amoron-dalana nefa izay tsy nahazo na le vary na le resam-bolo dia ohatrany hoe le zanako izany mampalahelo anahy zay lafo no hohanina zany satria le zanako tsy maintsy mihinana.
The president launched an emergency social plan to face the crisis. About 80,000 families in Antananarivo received 25 euros cash recently as part of this plan. It was funded mainly by international donors, but there wasn't enough for everyone. Some say this crisis is the worst Madagascar has ever known, worse than the social and political turmoils and coups the island has suffered from in the past. This special program, Africa and the Coronavirus Challenge, comes to an end. Thank you for having watched our reports all over the continent. We saw that the situation varies greatly from country to country. You can be sure that all France 24's correspondents in Africa will continue to follow closely the evolution of this pandemic. Take care. Goodbye.